Look, we get it. You've got questions about your liver. Maybe it's been acting up lately, giving you the side eye in the mirror. Or perhaps you're just curious about what this unsung hero of an organ actually does all day. Well, buckle up, because we're about to delve into the fascinating world of liver health. By the end of this video, you'll be practically fluent in liverese, able to impress your doctor with your newfound knowledge. Just don't blame us when they start charging you more for the appointment. The liver respect. It's not exactly the sexiest organ, is it? I mean, it's no heart, throbbing away with passion and whatnot. And it certainly doesn't have the brain's PR team, always boasting about its intelligence. But let me tell you, your liver is a workhorse. This fist-sized organ tucked away in your abdomen is constantly filtering your blood, breaking down toxins, and generally keeping you alive. So show some respect. First up, detoxification. Your liver is basically the bouncer of your body, filtering out all the nasty stuff you put in it. Think of it as the ultimate wingman, protecting you from yourself after a particularly rough night out. Then there's bile production. Now, bile might sound gross, but it's actually crucial for digestion, helping you break down fats like a champion. And let's not forget the liver's role in storing vitamins and minerals, regulating blood sugar, and even producing proteins that help your blood clot. This organ is a multitasking machine. So how do you keep this vital organ humming along? Well, it's surprisingly straightforward. First and foremost, lay off the booze, or at least cut back. Your liver can handle the occasional glass of wine, but a nightly bender, not so much. Next up, eat your veggies. A balanced diet full of fruits, vegetables, and whole grains will make your liver do a little dance of joy. And finally, get moving. Exercise is like a magic elixir for your entire body, including your liver. Now let's talk about what happens when things go wrong. Because your liver is a trooper, it often suffers in silence. But eventually it'll start sending out distress signals. Think fatigue that just won't quit, unexplained weight loss, or skin that's taken on a yellowish tinge. Not a good look, trust me. If you experience any of these symptoms, get thee to a doctor, stat. One of the most common liver conditions is fatty liver disease. And the name says it all, really. It's when your liver starts storing too much fat, like a hoarder of triglycerides. This can be caused by a number of things, including obesity, diabetes, and yes, our old friend alcohol. The good news is that fatty liver disease is often reversible with lifestyle changes. So, put down the donut and pick up a dumbbell, people. Next up, we have hepatitis, which is basically just a fancy word for liver inflammation. There are different types of hepatitis caused by viruses, alcohol abuse, or even your own immune system going haywire. Hepatitis can be acute, meaning it comes on suddenly, or chronic, meaning it hangs around like a bad house guest. The good news is that there are treatments available, so if you think you might be at risk, get tested. Chapter 7. Liver Regeneration, the Wolverine of Internal Organs. Now, for some good news. Your liver has an almost supernatural ability to regenerate itself. It's like the Wolverine of internal organs. Even if a large portion of your liver is damaged, it can often repair itself over time. However, this doesn't mean you should treat your liver like a punching bag. Repeated damage can lead to scarring and eventually cirrhosis. Section 8. Alcohol and your liver. A toxic relationship. We've talked a lot about alcohol already, and for good reason. Excessive drinking is one of the leading causes of liver disease worldwide. It's like a toxic relationship that your liver just can't seem to quit. Every time you binge drink, you're essentially punching your liver in the face. So do your liver a favor and break up with the bottle. Up next, food for thought, your liver's dietary preferences. What you eat has a huge impact on your liver's health. It's like the old saying goes, you are what you eat. And nobody wants to be a greasy burger and fries, am I right? So what does your liver crave? Think fresh fruits and vegetables, whole grains, lean proteins, and healthy fats. Basically all the things your mom always told you to eat. Cirrhosis is essentially the final stage of liver damage. It's what happens when your liver has been through the ringer and is just too tired to fight anymore. The liver becomes scarred and shrunken, and it can no longer function properly. This can lead to a whole host of complications, including jaundice, fluid buildup in the abdomen, and even liver failure. Liver cancer is, unfortunately, exactly what it sounds like. Cancer that originates in the cells of your liver. It can be a primary cancer, meaning it started in the liver, or a secondary cancer, meaning it's spread from another part of the body. Treatment options for liver cancer vary depending on the stage of the disease, but may include surgery, chemotherapy, radiation therapy, or a combination of these approaches. The good news is that many forms of liver disease are treatable, especially when caught early. That's why it's so important to be aware of the early signs of liver damage, such as fatigue, loss of appetite, and abdominal pain. If you experience any of these symptoms, don't ignore them. See your doctor and get checked out. Obesity is a growing problem worldwide, and it's not just bad for your waistline. Carrying around extra weight puts a lot of stress on your liver, increasing your risk of developing fatty liver disease and other serious conditions. So if you're overweight or obese, losing even a small amount of weight can make a big difference for your liver health. While we often think of the stomach as the main player in digestion, the liver actually plays a crucial supporting role. One of its main jobs is to produce bile, a fluid that helps break down fats. Without enough bile, your body would have a hard time digesting fatty foods, which could lead to all sorts of digestive problems. Prevention, the best medicine for your liver. The best way to keep your liver healthy is to prevent damage in the first place. This means making healthy lifestyle choices, such as eating a balanced diet, exercising regularly, and avoiding excessive alcohol consumption. It's also important to get vaccinated against hepatitis A and B, which are viral infections that can cause serious liver damage. Chapter 16, Hepatitis C, a treatable condition. Hepatitis C is a viral infection that can cause chronic liver disease. The good news is that hepatitis C is now highly treatable with antiviral medications. In fact, most people who receive treatment for hepatitis C are able to clear the virus from their bodies and prevent further liver damage. Last chapter, give your liver some love. So there you have it. Everything you need to know about keeping your liver happy and healthy. Remember, this unsung hero of an organ works tirelessly behind the scenes to keep you alive and kicking. So show it some love by making healthy choices and getting regular checkups. Your liver will thank you for it. The finale, that's all, folks. Well, that was a wild ride through the wonderful world of liver health. We hope you learned a thing or two and maybe even chuckled a bit along the way. Remember, knowledge is power, especially when it comes to your health. If you found this video helpful, please give it a thumbs up and subscribe to our channel for more informative and entertaining content. And as always, thanks for watching, and we hope to see you again in the next video.